Introduction. First, pediatrics. So, pediatric is derived from the Greek word. The pediatric word came from the Greek. It consists of pedia, it means a child, iatrik means a treatment, it's a branch of science. So, in simple words, we can say pediatric is a branch of medicine that deals with the care of children and adolescents. So, in pediatric, we have to care for the children and adolescents. Now, exact definition of pediatric. So, pediatric can be defined as a branch of medical science which deals with the care of children from conception to adolescence in health and illness. It is concerned with preventive, promotive, curative, and rehabilitative care of children. So, pediatric, it is branch of medical science, and in pediatric, we have to care for the children, that is starting from conception to adolescence. Conception means the period when the mother conceives a baby, that is when a sperm and egg get fertilized and zygote is formed. So that period is called from conception to adolescence. Adolescence means period from 13 years to 19 years, that is teenage group. So from that period, from conception to adolescence, we have to care for children, that is both in health and illness. We have to care for those children also who are healthy and those also who are ill. It is concerned with preventive, promotive, curative, and rehabilitative care of children. So in pediatric, we have to provide preventive care. That is, before occurrence of any disease, one can prevent it. Example, tuberculosis. So for tuberculosis, BCG vaccine is given at the time of birth. Then promotive care. Promotive care means we have to promote the health of a child. So for this, we can give health education to teachers, students, parents, and child. Curative care, when a disease has already occurred, so one can give curative treatment. And rehabilitative care of children. Rehabilitative care means to restore the function to the maximum level. So the child who is physically challenged or deaf, dumb, so he can give rehabilitative care to that children. This is it, from conception to adolescence, that is pediatric. Next topic is modern concept in child health care. So some new ideas were generated in child health care. So health is, it is a complex phenomenon. It is not a simple one. Definition of health is, it is a state of complete physical, mental, social, and spiritual well-being, and not merely the absence of disease. Definition as per WHO, World Health Organization. So as per World Health Organization, when a person is physically, mentally, socially, and spiritually healthy, he is called a healthy person. A health is the fundamental right of every human being. We all have a right to be healthy. A healthy child becomes a healthy citizen, and a healthy citizen makes a healthy nation. When a child is healthy, he will become a healthy citizen, and when he becomes a healthy citizen, he will make a nation also healthy. And modern concepts of child care. The child care has a prime importance as the mortality and morbidity rates are to the highest in this group, but many of the diseases are preventable. Here, child care is given much importance because the mortality, that is death rate, and morbidity rates, mean disease condition rates, is death rate and disease condition rate were high in children. Even though some diseases are preventable by giving immunization, so for this, child care is given much importance. The goal of pediatric nursing is to foster the growth and development of the child and promote an optimum state of health so that he may function at the peak of his capacity. So here the goal of pediatric nursing, child health nursing, is to foster the growth and development. Growth means physical growth and development means mental development. Both physical growth and mental development is the goal of the pediatric nursing, and to promote the child health to the maximum level so that he can do all of his activity. The nurse must have patience and emotional balance while dealing with children and their parents, especially in critically ill cases. While dealing with children in hospital and with their parents, so nurses should have patience and emotional balance. So when a child is having any serious illness, so child may become irritated or upset, and their parents also become irritated. So as a nurse, we can't show them our anger. So as a nurse, we must have patience and emotional balance. Then concept relating to the care of the child and nurse's role. First is health promotion and prevention of illness. Second is health maintenance, and third is health restoration. First, health promotion and prevention of illness. The goal of this is to help families and their children for a higher level of wellness and to prevent illness wherever possible. So here the goal is to help the families and their children so that they can attain their maximum health and to prevent illness whenever possible. The nurse can fulfill these goals through individual or group education of parents, children, school teachers, and other groups whose concern is for the health of the youngest segment of our population. In our population, children are the youngest segment. So our goal is to maintain their health, and we can maintain their health by giving group education or individual education. This education is given to parents, to children, to school teachers, and other groups. Education can be given on disease condition or for good habits. Then health maintenance. It refers to the health care of children who are essentially well and of those children who have chronic health problems that do not interfere with normal function. In health maintenance, we have to maintain the health of the children who are essentially well, means who are healthy, and of those children who have chronic health problems. Chronic health problems means what? Those health problems that last for a week, for months, for years, or even for a lifelong time. So that problems are called as chronic health problems. So we have to maintain their health. The nurse's role here is supportive and educative. The nurse role here is to provide support to the child, to the family, and to provide education to both parents and the children. Example, children who are mildly retarded may be given additional care as necessary. Here example is that child who is having a mental problem, that is mildly retarded. So they can't do their all work by themselves. So they require some care from others. So as a nurse, we have to give them additional care whenever it's necessary. Then third is health restoration. It refers to the health care of ill children or those whose conditions deviate from normal functioning. In health restoration, we have to restore the health of those children whose health is already deviated from their normal functions. The illness may be acute and short-term or chronic and long-term in nature. Here the illness can be for short-term, that is for short time period, or chronic, that is having health problems that last for a long time. Example, say if a child is physically challenged, he can't walk, so we can restore their health by providing them crutches or wheelchair. The next topic is friends in pediatric nursing. Friends means what? So some developments were made in pediatric nursing. So why there was a need to develop in pediatric nursing? So there were some reasons. So the reasons were first is child mortality, means death rate. So there were many deaths in children and high infant mortality. Infants means what? So a child from 28 days to 1 year, that is called infant. So in these children also death rate was high. Then immunization rate. So in the mothers, the parents who were living in village, so they were not having enough education, enough knowledge about immunization. Then low birth weight. The normal birth weight of a baby is 2.5 kg. When a birth weight goes below this 2.5 kg, it is called as low birth weight. So the children were born with a low birth weight. So because of all these reasons, there was some development made in child health care. So first is family-centered care. The caregiver realized that the family, community, society surrounding the child have a particular way of life or culture. The health is influenced by this and other factors. The nurses, the caregivers, they realized that a child living in a family, living with his neighborhoods, participating in the society functions, they were healthy. They were different when those children who were living alone, who were with their single parents, who were homelessness. So definitely family affects the child's health. Separating a child from family for hospital will not provide his basic demands and needs. So the care will be provided in home depending on family characteristics. When a child comes to hospital for a hospital stay during his illness, so as a nurse, you should not separate a child from his family. If we separate a child from his family, then his basic demands will not be fulfilled. Second is institutional care. Following the deaths and disease, children were kept isolated from in hospital, there were deaths and diseases. So children were kept isolated. They were kept separately, so they may not get infection of other children. Children were ambulated as soon as possible and made to visit playrooms where they can be with other children. So during their hospital stay, the children were made to play in rooms. So their movement will start as early as possible. Nurses were trained to raise their level and provided daily care for children. The nurses were given training so that their knowledge will increase and this will help to provide them care to the children. Then third is regionalized care. Providing high quality medical care in pediatrics was important for best resources in diagnosis and treatment. So as a nurse, we have to provide best quality care to the pediatric patient. So this will help in diagnosis and treatment. Some of the branches were pediatric medicine and surgery, pediatric neurology, pediatric gastroenterology, pediatric cardiology, pediatric nephrology, pediatric urology, etc. These all above are the branches of pediatrics. This regionalized asks the patient to come to hospitals for better and sophisticated health service. So these specialist doctors, they ask the patient to come to the hospital so they get better care at that place. Fourth is other innovative child healthcare programs. Many pediatric hospitals have home care programs for child illnesses like leukemia, hemophilia, etc. So in India, many hospitals are there that provides home care to the children. So for such illness like leukemia, hemophilia, etc., leukemia and hemophilia are blood disorders. Leukemia means cancer in blood forming tissues, and hemophilia means there is as a normal adult man gets injury. So after some time his blood will clot, but in hemophilia the blood never clots. So that condition is hemophilia. By hospitalization, child condition is monitored at home for continuing care. So those children to whom care is given at home, their condition is monitored at home only. Evidence-based practice. Nurse need to make decisions on the best available evidence. EBT in nursing provides a systemic approach, enables nurses to effectively use the best solution related to nursing practice. So while taking any decision, the nurses should have the best evidence. Example, a child complains that I am having a hot body, that is having a fever. So for evidence, nurse would check his vital signs. So this is the evidence for a nurse. So with evidence, he or he can provide this care to the patient. Then sixth is child-oriented environment. A child-friendly environment should be provided to a child who is admitted in the hospital. So where child that is admitted in the hospital, that child should be provided such environment which child like. Seventh is a traumatic care. So first, do not harm. Then best possible care with minimum cost. We have to provide care but with low cost to prevent duplication of nursing care. One must take care that to prevent duplication of nursing care. Thank you.